Hi, my name is Leopold Reddy. I am an OB-GYN international clerk. Today we are going to perform Leopold's maneuver in our patient. Before performing the examination, we will ask the patient details and we will ask the patient to empty the bladder and explain the procedure to the patient before performing. First we will start with the inspection. We will inspect the patient's abdomen for any scars or lesions. First we have to measure the finding height. For measuring, we have to start from symphysis pubis to the uppermost part of the abdomen. This will be the fetal height. Leopold's maneuver 1. Before touching the patient, we have to warm our hands as cold hands may stimulate uterine contractions. If we find any round film ballotable mass, this may be the head of the fetus, or if we find any soft bulkier mass, this may be the buttocks of the fundus. If we find head in the anterior part of the abdomen, this may be the cephalic presentation, or if we find buttocks on the anterior part, this may be the breech presentation. Leopold's maneuver 2. We will use both our hands simultaneously on the abdomen and we will check for the fetal bag. If we find any curved surface, hard curved surface, this may be the back of the fetus, and if we find any irregular surfaces, this may be the extremities of the fetus. When we find the fetal bag, we will use a bell of our stethoscope to check for fetal heart tone. Leopold's maneuver 3. We will place our hand on the lower part of the abdomen and check for the fetal head. If the fetal head is movable, this means the fetal head is not engaged. If the fetal head is not movable, it means the fetal head is engaged. In Leopold's maneuver 4, we will face opposite to the patient and use our both hands. If my hands are going to converge, it means the fetal head is not engaged. If my hands gonna diverge, this means the fetal head is engaged. So after completing the examination, we will ask the patient to dress up in private and we will explain the findings to the patient and we will thank the patient for participating in the examination. We are going to perform breast examination in our patient. First we will introduce ourselves to the patient and ask for the patient details like name, age, and after that we will ask the patient consent to perform the examination and we will explain the procedure to the patient. Now ask the patient to undress and expose only the part that we are going to examine. First, general inspection. We will ask the patient to sit upright with her hands flexed and we will look for any scars, lesions or asymmetry or nipple changes or skin changes. And next, now we will ask the patient to keep her hands on her hips and ask her to lean forward and check for any masses, scars, swelling, nipple changes, skin changes or asymmetry. And again we will ask the patient to keep her hands behind her head and look for any masses, scars, swelling or asymmetry or nipple changes or skin changes. We will ask the patient to be in supine position and cover the part that we are going to examine. And first, gently squeeze the nipple and look for any discharge. If there is any discharge, look for color, order and consistency of the discharge. And same with the other nipple. While performing, we should start with the asymptomatic breast first. And if there is any discharge, we look for color, consistency and order of the discharge. For examination of the breast mass, we use spiral method and we will use three finger pads for palpation of the breast tissue. And while palpating, if you feel any mass, we can note down. And at the same time, we will perform palpation on the other breast also. You have to palpate from superficial to the deep. Examination of the axilla. We'll start with medial, lateral, anterior, posterior, and the apex of the axilla. After this, we are going to perform the general lymph node examination. We will look for cervical, supraclavicular, infraclavicular, and parasternal lymph nodes. After completing the procedure, we will ask the patient to dress up in private, and we'll explain the findings to the patient, and we'll thank the patient